Welcome, everyone. My name is Dr. April Bolton, and I am Associate Provost and Dean of the Graduate School here at Hood College. Greetings on this Thursday, what is for many of you probably your lunch slot. Thank you for joining us for this next episode of Hood Talks. I'm very excited to welcome you to today's event. And boy, do we have a treat for you. Sorry, I had to do it given the topic for today. Just some brief logistics. Please keep your camera closed as we will be recording this session, and want to be sure to avoid any distracting open webcams for our keynote speaker. But please do get ready to engage, even though you may be off camera. We will have polling questions popping up at key moments that Professor Eaton will be guiding our discussion using those. So get ready for some fun with that. And now I would like to introduce our keynote speaker. Professor Joanna Eaton is a registered dietitian, nutritionist, and certified diabetes care and education specialist with over 14 years of experience working in the field of nutrition. She has experience providing nutrition care in community, public health, clinical, consulting, and industry settings. She earned her MSPH with a concentration in health education and health communication from Johns Hopkins Bloomberg School of Public Health in Baltimore, Maryland. Last May, I'm going to brag for just a moment, Professor Eaton was honored with a very coveted Excellence in Teaching Award here at the college, which is based exclusively on graduate student nominations for that award. She is an incredibly dedicated educator, a valued colleague, and brings deep expertise in nutrition science. Professor Eaton lives in Frederick, Maryland with her husband, son, and 3 rescue dogs. Please join me in welcoming Professor Joanna Eaton to the Zoom console.
Hello, thank you so much for the introduction, Dean Bolton. It's my pleasure to be here with everybody. This is a topic that is near and dear to my heart, and I think also a very interesting topic that hopefully you guys will get a lot of practical tips from. So I am going to share my screen. Let's see. Hopefully I'm doing this right. All right. Okay, good. All right. So the title of my talk is Nurturing a Healthy Relationship with Food. And hopefully that's a phrase that some of you may be familiar with, but we're going to unpack that throughout the talk. And we're going to be discussing 2 complementary but different techniques to do that. So mindful eating and intuitive eating. All right, let's see here. Oh, sorry. All right. Disclosures. I do not have any disclosures to report, so I'm not being paid by the Intuitive Eating organization. And also, full disclosure, I am not a certified intuitive eating counselor. There are certified intuitive eating counselors, so I would encourage anybody who's interested in working one-on-one with a counselor who specializes in this to visit their website, which I will share later on. Okay, and then just a disclaimer that this information is for educational purposes only. It shouldn't be taken as medical, nutrition, or psychological advice. And we always encourage you to follow up with your provider before making any changes in your healthcare, your diet, things like that. All right, so for our agenda, we're going to review 10 principles of intuitive eating. First, I'm going to give you just a broad intro of what intuitive eating is and mindful eating. And then we're going to discuss some of the benefits and research behind it, and then go over kind of the nitty-gritty how-to, as well as some mindful eating practices that can help you become a more intuitive eater. So before we begin, I did want to ask you guys a question, just to see how familiar you guys are with these 2 topics. So if you could please complete the poll and just let me know how familiar you are or not familiar you are with either mindful or intuitive eating or both. See
We'll
those
let it go
answers.
another 5 seconds. Please vote if you have not yet voted.
All right. So I'm seeing about half, almost half, are not familiar with mindful and intuitive eating. And then it looks like more of you are familiar with mindful eating versus intuitive eating. So good. So hopefully everybody will learn something today. All right. So I did not come up with intuitive eating. It is a framework that was developed over 30 years ago by two registered dietitian nutritionists. Oops. Their names were Elise Resch and Evelyn Tribole. And they also have advanced certifications in eating disorders and things like that. But it's not a diet. It's not a theory. It's a mind-body self-care framework. So it combines our thoughts, our feelings, and our physical needs all under one framework to help us understand how we eat, why we eat, and what we should be eating. It really centers the individual as the expert on their body. So rather than you following somebody else's diet advice, or even the dietitian is the expert, we are the food experts, right? But it recognizes that each individual is the expert of their own body. And the focus of intuitive eating is, again, to create a healthy relationship between yourself, food, and that mind-body connection. So does it work? So intuitive eating is not a weight loss method. A lot of people may turn to it for weight loss, but it's not specifically, it's actually a weight inclusive framework. So it's not meant to promote weight loss per se. It's really focusing on um, healthy habits and healthy self-image and healthy thoughts. So there have been lots of studies, over 200 studies have been done on intuitive eating and higher intuitive eating scores. So people that demonstrate higher intuitive eating habits has been associated with better appreciation for your body, lower disordered eating patterns. So whether that's restricting, purging, binging, greater psychological well-being, stable weight history. So we'll talk about why the weight yo-yoing is so harmful, that goes along with the diet cycling later on. So having a stable weight is in some ways healthier than going up and down with your weight. And then it has been linked to improved metabolic outcomes related to chronic disease, and also linked to people practicing healthier behaviors overall. So when people embrace this framework, they end up taking better care of themselves. And if you guys want to learn more, I'd encourage you to check out the Intuitive Eating website. They have a whole link to all of the studies. Mindful eating is a separate concept that really, it's hard to pinpoint the exact foundations of mindful eating, but it comes from the mindfulness movement. So John Kabat-Zinn is a pretty popular mindfulness practitioner, and it's about bringing those mindfulness practices to the practice of eating. So increasing our non-judgmental awareness of food itself, so the sensory qualities of food, um, the process of eating, how our body is feeling while we're eating, and then any thoughts or feelings that come up as we're eating. So it's the idea of really focusing on your food and the process of eating while you're having a meal or a snack. Okay, and then also eating triggers. Okay, so if we're, sorry, this image is a little blurry, but the main point I wanted to point is that the mindful eating is like kind of a small tool that can help us become better intuitive eaters. So if we're thinking about how they're related to each other, mindful eating kind of can help us become intuitive eaters. It's one of the skills that we use to be more intuitive. So I wanted to just highlight one concept that kind of overlaps with both mindful and intuitive eating. It's a word that you probably are not familiar with. It's called interoceptive awareness. So it sounds like a technical sciencey word, but it's really just the ability to listen to your own body signs and signals and to understand and interpret them accurately. So that could be as simple as having to pee, feeling sweaty, feeling anxious, feeling thirsty, feeling hungry or tired, temperature differences. So being able to tune into what our body is telling us with those signals. And that overlaps with mindful eating because we're being aware of what's going on in our body and how the food is making us feel. And also, it's a big part of intuitive eating because intuitive eating is all about letting your body tell you when and what to eat and letting your body guide those decisions instead of an external force like a diet or a fad or something like that. So, there are 10 principles to intuitive eating. I'm not going to read all of these to you right now, but we're going to go through them one by one individually. But I highly recommend if you want to learn more about intuitive eating to purchase the one of the intuitive eating books. There's like 4 different books on it that I have in the slides. And they go through each of these principles even more in depth. So I'm just going to kind of briefly cover them, but they do go a lot deeper. All right, so before we jump into number 1, which is reject the diet mentality, again, I want to kind of just get a pulse check on the audience. Has anyone used a restrictive diet? So if you guys could fill the poll, just kind of get a feel for what is our history with dieting. All right, so the answers are coming in. It looks like most people have tried a diet. Some not recently, but 65% so far have dieted in the past. So definitely a common phenomenon and one that we've all are familiar with, whether we've dieted or not. So, all right. Okay, so number 1 is reject the diet mentality. This also could be called reject the diet culture. And what it's getting at is letting go of the belief that a diet is going to solve all of our problems or make us be healthy and happy. And that belief really stems from internal thoughts, and internal, wanting to control things, or feeling out of control and feeling like a diet will help us be in control of our body and our food and our life. And it also can come from external influences. So that's where the diet culture comes in. So all of the fad diets, all of the celebrities and magazines and social media posts about weight loss and clean eating and things like that. Negative thoughts about yourself or negative comments from other people that people have made towards you. So the first step in intuitive eating is really taking an inventory of your own internal beliefs about eating, and then also how have external forces influenced your relationship with food. And a lot of times we have unhealthy or untrue beliefs about food and our bodies and our self-worth. And also, a lot of times, if we take a step back, we can recognize how that diet culture has maybe had a negative impact on us. So again, I'm not going to get into this too in depth, but the first step is letting go of diets. And by diets, I mean restrictive diets for weight loss, not necessarily like a medical diet that you have to follow for medical reasons. Like if you have a food allergy, I have celiac disease. So not a medical diet, but more of like a restrictive weight loss diet. So why does dieting not work? There are 2 kind of different mechanisms of why dieting is often unsuccessful. So I'm going to talk about the physical cycle and then the psychological cycle. So what you see on this picture here is the deprivation, guilt deprivation cycle. Some people call it the weight cycle. There's lots of different versions of this, but the idea is that when you go on a diet for weight loss or for any type of restrictive diet, you forbid foods, right? So you have a list of do's and don'ts. You can't eat these foods, you should eat these foods. And what happens when we tell ourselves that we can't eat a food? We start obsessing over it. And so we call that the forbidden fruit backlash. So initially we have a lot of willpower, we're motivated, but then life happens, we get stressed. We only have so much willpower to deal with all of our stressors throughout the day. And eventually the one that we have reserved, the willpower we have reserved for food, starts to break down and get depleted. And so what happens is the more you think about restricting that food, the more it becomes almost like this like forbidden fruit that you want to eat more. It takes on more of a power. So think about if you told yourself, I'm never going to eat ice cream again, or cookies or pizza. Your brain is going to start feeling that like kind of sense of sadness or depletion and want to eat that food. And then what happens is eventually we break down because we're all human, right? And then we either overindulge and eat too much of that food. And then we say, well, I'm just gonna have it this one time, so I might as well just go overboard. We call that like the Last Supper eating effect. Or we feel out of control around that food. So we end up eating too much of it, maybe into the point of we feel sick. We're not even enjoying it. It's just the idea of eating it that brings us that emotional relief. And then what happens is then that gives you more evidence that you have to be on a diet to control yourself. And so it just kind of feeds into that cycle. You put yourself on a diet, it creates these forbidden fruits that you crave, and then you end up eating them, and then you feel guilty, and then you go back on the diet. So that's the psychological part of dieting. The physical part is what happens to us metabolically when we lose weight. So every time we lose weight, our body actually has metabolic adaptations. So our metabolism will slow down, we'll start to conserve energy a little bit better. It doesn't happen right away, but over time, as you lose weight, it becomes harder and harder to lose weight because your body is adapting metabolically to help preserve your weight. And so what happens is over time, if you lose weight, especially if you go on like a crash diet and lose weight really fast, you tend to lose more muscle mass than fat mass. And then if you fall into this cycle where you feel out of control, you fall off the wagon, you get off your diet, you gain the weight back, you're going to gain it back more as fat and less as muscle. So over time, your resting metabolic rate actually decreases with all of the yo-yo dieting. So hopefully that's not too complicated, but I just wanted to kind of briefly go over, why yo-yo dieting and yo-yo weight cycling is harmful. All right, so how can we let go of the diet mentality? It is really hard because we are constantly bombarded with messages, but just realize that, diets typically in the long run, they don't work, they're not sustainable. We know this from research. People typically maintain weight loss for maybe up to 5 years. That's considered like a success, and then they gain it back. Now with all of the weight loss drugs, that may be changing. But as of now, that's the case. So just realize that diets, they typically, when we talked about that interoceptive awareness, they actually kind of separate us off from listening to our body, because instead of listening to our body, we've replaced those signals in our body with the diet rules that we're supposed to follow. So we're going to talk a little bit more about how to replace diet mentality, but for now, the first step is to let go of it. So letting go of the idea that a diet is, that you need to be on a diet, unfollowing diet culture on social media, and then replacing diet rules with trust affirmations. So we'll talk a little bit about what that could look like. So another thing that you could do just, after this talk is over, that I invite you to do is to reflect on, has dieting impacted you? And reflect on the impact it's had. Has it been overall net negative or net positive? And see if it's something that you would be open to maybe letting go of if you're still on a diet right now. Okay, so just some examples. I did not come up with this. I got this from another dietitian, but I thought this was cute. A lot of times you see articles about burning fat, losing weight, clean eating, calorie reduction. So she kind of took all of those diet words and reframed them. So don't worry about burning fat, burn a scented candle. Your weight does not equal your health. Our food is not clean, our hands, our space, our face is clean, right? Eating without judging, things like that. Count things you're grateful for instead of counting calories. So just some examples of ways you can reframe the diet mentality. All right, intuitive eating principle number 2 is to honor your hunger. So again, this goes into that attunement. So being in tune with our body and knowing when we're hungry. A lot of times we don't know when we're hungry, and it catches us off guard. And then when that happens, we could end up overeating. And the reason why that happens is when we ignore our initial signs of hunger, and get to the point of like super hungry, we call that a primal urge to eat. So the intuitive eating framework, that's called a primal urge. And what happens is if you ignore your body's hunger cues long enough, it's going to trigger that primal urge, and that kind of flips a switch in our brain where we just go a little bit out of control and we just want to eat everything in sight. So it's a lot harder to eat mindfully when you get to that point. And we're going to talk about a tool that's helpful for us to check in with ourselves and our hunger level. So we want to make sure that we are feeding our body with adequate energy, carbs, proteins, fats, all of the nutrients that we need. And just realizing that hunger is not bad. It's not a weakness. It's actually part of our body's wisdom in making sure that we get what we need every day. So poll question number 3. Everybody experiences hunger differently. So I'm just curious how you all experience hunger. And I think you can select more than one. I'm not sure how the
Yeah,
poll works.
should be
Okay.
able to. Yep.
So you can select all that apply. All right, so stomach growling, that's an obvious one. Most of you have that. Some have more like irritability or headache, lightheadedness, anger. We call that hangry. That's about half of you. And then starting thinking about food, but stomach growling. So we tend to all feel hunger in our stomach, for the most part. So, and then some of you aren't sure when you're hungry, and that's okay too. So. All right, thank you. Okay. So these are all common signs of physical hunger. And the reason why I put a picture of a baby on here is because babies are very good at telling us when they're hungry, and they're very in tune to their own hunger cues. So part of intuitive eating is kind of thinking back to when you were a child before, maybe you had family members say things about what you should be eating or your weight or things like that. And for some of us, that can happen really young, even as a child, which is very harmful. But we want to think about before that, before we got inundated with all of these diet messages as a child, hopefully, there was a time where you were just eating because you were hungry and you're in tune to when you were hungry. And so we kind of want to get back to that innate ability to sense when we're hungry and let that guide our food decisions instead of a diet. So for one way that we can do that is a hunger scale. And we can use this to evaluate our hunger and our fullness. So if you think about your hunger, and there's different versions of the hunger scale, you could make your own based on what your own symptoms are, or your own signs of hungriness, hunger. But the goal is to stay in this green zone. So you want to eat when you start to get towards a 3. So when your stomach is growling, that's a good sign, or feels, empty. You want to eat then versus waiting until you're, feeling like you're about to pass out or getting hangry, or irritable, really fatigued. So we want to stay in this green zone between the 3 and the 6. So on the hunger end of this, which we're just going to focus on right now, you don't want to wait till you get to a 1 or a 2. You want to try to eat when you're, a 3 or a 4. So this can be helpful. Sometimes I've had patients like post this above their desk at work. or on their fridge, just as like a check-in, like, hey, am I hungry right now? It can kind of help prompt them to eat. So number 3, and this is my favorite principle actually, is to make peace with food. So what does that mean? That means give yourself unconditional permission to eat. There are no good or bad foods. Foods do not have a moral quality to them, and eating certain foods does not make you a good or bad person. So giving yourself unconditional permission to eat is so important because we know that if you're restricting food, that's what ends up leading to obsessions and then overeating later on. So this can be very tricky for some people, especially if you've had a food that you're like, well, if anytime you eat it, it induces feelings of guilt or fear or anxiety, that might be a food that you need to make peace with. So that might be one of your forbidden foods. So, and a lot of times what happens is when you allow yourself to eat it and eat it mindfully, it takes the power away from that food and you can enjoy it without feeling out of control around it. So making peace with food, mindfully eating some of those forbidden foods, letting go of the guilt and fear, and just realizing that food is food. It's just food. So this can be, easier said than done. And I would encourage you, if you do have, a history of disordered eating, it might be helpful to do this with a therapist or with a dietitian, or at least just a support person. All right. So I'd like you to think about, and, you don't have to share this, but just are there any forbidden foods in your diet repertoire that you feel like are just completely off limits or, that you would feel guilty or feel like you need to compensate if you eat them? Like, oh, I can eat that, but then I need to go run 5 miles. If you have a food like that, that's probably not a healthy relationship with food and something that you may want to consider liberalizing in your life. Okay, so closely related to that is challenging the food police. The food police is that inner critic inside our head that that tends to label foods as good or bad, or label ourselves as good or bad for eating certain foods. So, oh, I messed up. I went overboard. I ate, that bag of potato chips, or, I ate too much at dinner at a party or whatever. The goal with the food police and what I encourage my patients to do is listen to the way that you talk to yourself, or listen to the way that that food police talks to you, and imagine saying that to your best friend or your child or someone that you care about deeply. And a lot of times the way we talk to ourselves is a lot harsher and more critical than how we would ever talk to anybody that we love. And so I encourage you to have that same compassion towards yourself that you would put towards people that you care about, especially when it comes to food. Um, so replacing that judgmentalness with curiosity, like, oh, I overate. Why? I wonder what triggered me. Practicing compassionate self-talk, again, how you would comfort your best friend or your child. Use that same language towards yourself. Okay. And then number 5 is discovering the satisfaction factor. And this is where mindful eating also comes in really handy. Um, so it's about focusing on the enjoyment of food and whether or not we're actually getting any pleasure from eating our food. And the idea is that if we allow ourselves to be satisfied with food and we really tune into what is pleasurable and tastes good, we're going to naturally eat less of it or eat the amount that our body needs. So again, we're tuning into the food, we're tuning into our body and our hunger levels, but now we're tuning into the food itself. So this is where mindful eating can be very helpful. And you can see that it could be, mindfully eating a bowl of ice cream or mindfully eating some salad and vegetables. So it's not necessarily about the food itself, but about the enjoyment that you're getting from the food. A lot of times food is kind of like the bottom priority for our day, right? It's like we got to get our work done, we got to take care of the kids, we got to do our errands, and food is just an afterthought. So I invite you to think about how could food have a little bit bigger of a priority in our lives, and how could we make space in our lives to actually have experience that satisfaction from eating. So eating without distractions is a good tip. Turning your phone off, shutting your computer off, shutting the TV off, thinking about what you're in the mood for, and then we'll talk about how to savor food as well. So satisfaction is considered the hub of intuitive eating. That's kind of why it's number 5 in the middle. And it's, part of that is that it's helping you when you're focused on what truly satisfies your body. You're going to eat what your body needs, and also you're going to eat the right amount. So it actually ends up, if you're focusing on satisfaction, it actually helps you not overeat. Believe it or not, sounds kind of counterintuitive, but it actually helps you focus on the food you're eating, enjoy it without guilt, and then you can just move on with your day instead of beating yourself up and getting back on that diet cycle. And then satisfaction, it's also promoting that mindful eating. So how can you enjoy your food? How can you be satisfied with your food if you're not even paying attention to it, right? So really involves focusing on your food in the process of eating, and whether or not you're really enjoying the food. And if you're not enjoying the food, then we need to think about why. Are you in the mood for something else? Is this like, what does your body really need in this moment? So number 6 is feeling your fullness. So listening for signals that you've had enough, feeling comfortably full, and instead of waiting for you to get stuffed. So again, the hunger scale is helpful here. And everybody has different feelings of when they start to feel full, but a lot of times we're not aware of when we're starting to feel full because we're not paying attention to our bodies or what we're eating. So we want to just get to that. We call it 80%. There's a Japanese concept called hara hachibu, where you just eat till you're 80% satisfied. And part of the reason we encourage that is it takes a while for our brains to catch up with our stomachs. So our stomachs may start to feel full, even though our brain wants to keep eating. So if we just kind of pause and stop when we're 80%, that's going to give us a little bit of time for everything to align. So eating slowly, putting your fork down between bites, that can help with feeling full. And then these are some of the mindful eating practices, and this is from Susan Albers. But being fully present, paying attention to your body, savoring the texture, the aroma, the flavor, and then just noticing things without being judgmental towards yourself. So all of these can kind of help. This mindful eating plate can kind of help with principles, 2 through 6 of intuitive eating. Here's some more mindful eating tips. Not gonna read through all of these, but another part of mindful eating is gratitude. So having, saying something you're thankful for before you eat, or reflecting about who made the food, the processes that got you the food, eating slowly, all of those things, sitting down, setting a table with a napkin and a plate and a fork. A lot of us just eat on our couches. So having an actual place to eat that's dedicated just to eating can also help with a mindful eating. All right, so we're going to switch gears a little bit and talk about other reasons that we might be eating. So could I have the poll question come up? All right. So does anybody eat for reasons other than physical hunger? I'm not seeing anybody answering. Oh, here you are. Okay. Like, am I the only one that eats for reasons besides physical hunger? Okay. All right. Cravings. Yep. Feeling emotions, sadness, stress, negative emotions, social situations. Some of us just eat because the clock tells us to eat, and that's okay. Boredom eaters. Yep. Okay. So I'm happy to see I'm not the only one that eats for reasons other than hunger. So we all eat for things besides hunger, physical hunger, and that's totally normal. And I'm not trying to shame anybody for doing that. But we're going to talk about maybe a healthier way to approach those feelings than simply eating. All right. Okay. So it's helpful. Principle 7 is helpful if you are an emotional eater or a boredom eater. or you just feel out of touch with your own hunger signals. So a lot of times, we want to focus on how can we cope with emotions besides eating. So that's principle number 7. So being kind to ourselves, but focusing on the fact that yes, a food may seem comforting in the moment, but it's probably not going to actually address whatever your emotional needs really are. So it can be helpful to identify your emotional triggers for eating. Maybe it's anxiety, maybe it's loneliness, and to make a list of alternatives. So if you're feeling, the urge to eat, but you're not physically hungry, what can you do instead? And so if you make a little list of, I call this like the 5-minute list. This is one of Susan Alber's ideas, but um, have a list of things you could do to relax, things you could do to distract yourself if you're bored, or things that you could do to engage your senses that don't involve eating. So maybe you just want to take a bubble bath or light a candle or listen to some music, go outside. You want to develop that toolkit of ways to cope with your emotions outside of eating. And then another part of this is just realizing that if you do end up emotionally eating, don't beat yourself up. Don't feel bad about it. Respond with that same compassion that you would have towards your friend or your child, right? So we're all emotional eaters to some extent. And this is just about gradually using other tools and developing other tools to help us um, cope with our emotions outside of food. Okay. So all of these things, before you take a bite to eat, just think about, am I really hungry or am I feeling something, and trying to address it through food. Another way you can differentiate between physical and emotional hunger is, again, this is Susan Alber's work, but she does have like a little checklist of, okay, if you're physically hungry, it's probably in your stomach. You probably haven't eaten in a while. If it's emotional, it's probably no physical cues, a specific craving. It seems like the only or the best option. And maybe you just ate something and now you want to eat something else. So one thing that I encourage people to do is before you take a bite to eat, or when you're feeling hungry and you're not sure if it's physical or emotional, just off the bat, put your hand wherever you're feeling that hunger. And if it's on your stomach, chances are you're physically hungry. But if it's not, if you end up putting your hand on your heart or your shoulders, your head, or wherever, most likely you're not actually physically hungry and it's an emotional need instead. So just do that little check with yourself. Okay, principle 8 is to respect your body. Again, this is more in depth, but accepting that people's bodies are different. We all have different genetic blueprints. We all have different shapes and sizes, and respecting our body and all that it does for us a lot of times is the first step towards accepting our body. And one of my favorite things to do is to thank your body for all the things it does for you every day. It gets you out of bed, it gets you out the door. Our legs are amazing. They take us everywhere, right? So show your body a little appreciation. Number 9 is to exercise, but again, it's not called exercise. It's called movement. So being in tune with your body and what kinds of movements actually make you feel good. So using exercise as a tool to feel good instead of burning calories or to punish yourself for eating. So we really want to reframe exercise into a joyful experience and emphasize consistency over perfection. So think about what types of movement, what types of exercise actually make you feel good that you can engage in on a regular basis. And then finally, number 10 is to honor your health with gentle nutrition. So we're not throwing out all that we know about healthy eating. We're choosing foods that honor our health and our taste, and just realizing that it's what we eat consistently over a long term that impacts our health, not something that we eat one time that's going to make or break our health. So you can have a cupcake, you can, have a treat, whatever that treat looks like. But it's what we're eating in the long term that's going to have the biggest impact on our health. And I would encourage you to think about what are healthy foods that you could add into your diet before you think about restricting certain foods. So maybe you need to eat more vegetables or more fruits. How can you figure out how to make those in a way that's appealing to you and that's satisfying? Some healthy diet patterns. Again, they're not diets, they're healthy diet patterns. Plant-based, whole foods, the Mediterranean meal pattern. Those are all healthy options that I encourage people to look into. So in summary, intuitive eaters are tuned into their internal cues, their body signals. They give themselves unconditional permission to eat without guilt. They understand the difference between physical and emotional hunger, and they know how to take care of both. And they choose foods that support their health and well-being, but also maintaining their flexibility and enjoyment. And then they're mindful eaters as well. So that is pretty much everything. Oh, I wanted to just show you, this is another example. What does an intuitive eater look like? So I'm not saying, oh, you should just eat whatever you want, eat pizza all the time or whatever. It could mean eating everything on your plate or leaving food on your plate. It could mean having a salad or a pizza. It could mean, having a craving and enjoying that piece of chocolate or whatever it is. Or it could be realizing that that craving is actually for an emotional need and doing something instead. So there's no one right or wrong way to handle all of these different situations. From an intuitive eating perspective, it's about listening to your body and understanding your body and following through on that. So, questions?
Thank you, Professor Eaton. Oh my goodness, that was really engaging and some great information. We have a lot of questions, so I would like
Okay.
to start serving these up to you. And for our audience members, feel free to post your question if you're not hearing it covered in what has already been posted. But yeah, we have a lot. I'll try to kind of combine where I see some overlap. Um, so a few people said, do you have more resources to help me reject the diet mentality?
Hmm.
One phrased this question with, I'm not really on social media much, so I don't think that is my issue. Are there books or websites you recommend to support the rejection of a diet mentality?
Yes, absolutely. So intuitiveeating.org is the key website. And on that website, let me see, can I share it here? Just share can you guys see it looks like this with their little logo.
Yep.
This book they're in their 4th edition now. Highly recommend reading this book. They also have a workbook that's more hands-on. So I recommend doing both. And if you get the workbook, it may be helpful to work through it with a counselor, a therapist, or a dietitian. And there are counselors as well. They have a counselor directory on their website. So you can find people that are certified in intuitive eating. They also have an online community of resources. If you go here, they've got